I want to ask a few questions to Ravi. Ravi, you started this campaign, Reach Each Child campaign, which talks about malnutrition. And your campaign, it operates in the interiors of Maharashtra. So what kind of responses have you been getting?
It's a very interesting question, sir. This campaign is now 2 years old and we have seen 0 deaths.
Oh.
0 deaths, which is reported by the National Rural Health Mission. This has only been possible by, working with the tribal girls which were there. We invested heavily with the tribals. We worked with them. My colleagues and myself, we also give a lot of time going there. And always one question comes to our mind, do our children will go to the same facility?
Yeah.
So that's the big triggering point, sir.
Yeah, very interesting.
So we upgraded the facilities. We took the local artisans. We made it more beautiful. We tried to give them medical facilities which were not available. We also saw, in the Melghat region of Maharashtra, still this telephone towers and mobile network towers are not there. So if someone has to call for the emergency, what is to be done? So what we did, sir, there's small motorbikes. We have given the motorbike ambulances in the primary health centers, so that with that motorbike ambulances, in the difficult terrain, children can actually be transported, sir.
Yeah.
We have also seen something very interesting. If we are referring a child, if the child reaches to the facility early, the chances of survival increase manifold, sir.
Yes.
So what has happened is, actually it was taking around 18 to 19 days for a family to actually identify the child, and child used to become very severely malnourished. So what we said, we trained our community health volunteers. These community health volunteers try to identify the cases, the hotspots in the villages, but in their local languages, which is Pavadi and Bhil. We created all the material for them, which is also there in the local language, sir. So the referral started taking place very early, resulting into early hospitalization, early identification, early treatment starting, resulting into lower of the cases, and finally, what we have seen, there are 0 deaths, and we have requests from the various state governments to start this program in the other tribal belts. So we are going to work with the Siddhi community, sir, which Nawab of Junagadh actually got them in Bhavnagar and Jamnagar in Gujarat. We are starting the same population, this program in the state of Rajasthan with Kalbelias, Nuts, Karnats, other indigenous populations. And we are also continuing our work in the state of Maharashtra. So this model, we are trying to take some good practices from there, and we are trying to take it to the other places now, from 1 state to 3 states now.
Yeah. What really is important, that when a child suffers, there's a huge delay in getting him to some kind of medical facility or a hospital. And some of the interior areas, they're so dense with forests, there are no roads, nothing. A lot of volunteers, as you were saying, they've got motorcycle ambulances. And I know of a gentleman in Assam who made his sidecar into a kind of a hood and a semi-bed. Wow. Yeah. And he drives this thing to all over the area that he lives in. And he's on a mobile phone and he attends, it's all voluntary work. But so many good examples because of that person. And he said the main thing was to be able to get the patient to hospital in time.
Yeah.
And this person was doing some human service to do that. So that's very interesting. And as far as nutrition is concerned, how do you verify what is being given to the kids is actually nutritious?
So very, very rightly said. So there are 2 ways of looking into this, how we see it. One is basically not to introduce something which is artificially induced into the communities. Helping them with the, community kitchens, kitchen gardens, the foods which are locally available, working towards that and telling them how to use it, how to make it better. Yeah. The problem is that the diet diversity. It's I can't be eating same rice and same khichdi and dal every day. So how to make it better, how to differentiate the taste, how you can add more ingredients which are all locally available. Yeah. Because mostly the regions where we are working are all forest regions, sir. So therefore, traveling is a problem. And then the first step what we took is, we did an ethnographic study. To our surprise, in India, from the last 1 decade, there's not a single ethnography which is available to understand the food patterns of the tribals and resulting into malnutrition. So that was the first step, sir. So what they're eating, how we can make it better. And then there are two approaches. So one is like treating at the community level, treating the malnutrition at the community level, where you're giving the appropriate food and encouraging moms to be healthier so that they can lactate, they can breastfeed, focusing on that. And the India average is around, say, 60% of the women actually lactate. In our regions, the last survey actually suggests it's around, 82% now. So it's always improving the first 1,000 days of the mom's and the kid's life. Yeah. Improving that gives the significant indicators like the disability adjusted life years. How many life years you are able to increase. So there's scientific ways to validate that, sir.
I just feel there must be a huge amount of resistance from tribal areas and from village areas, because they're always used to surviving on what they've been used to for hundreds and hundreds of years. Yeah. And then suddenly to get some kind of a modern facility, modern medication facilities, they're normally averse to it. It must be a huge task to be able to convince them. A lot of people like athletes, for example, Rahul, Abhishek is associated with, say, the Kabaddi team, and a lot of them come from, rural areas. And whenever they get injured, we immediately want to take them to hospital and say, no, humko gaon jana hai. And they go there and they actually get cured because they've got some local medication. So it must be a huge task to be able to convince the tribal area particularly, because they have set rules, regulations, way of living, everything.
So a lot of effort has actually, gone into selecting the women from the households, where we invested significantly, because the superstitions were all-time high. Not taking it to, and there is one hot chimta what they put on the child's stomach, and they burn it and they say like, now child will be better. So you see a lot of marks on the child's belly, sir. Yeah. So what we did, sir, we actually worked very significantly with the traditional healers. We told them it's beyond you. You can take care of the smaller things. We invest in you, and we can actually tell you like, how to check fever, temperature, exactly, yes. And the very basic, patti karna, how to do bandage and all, yes. with the Red Cross and the Plan India. But largely like 6 months were heavily invested in understanding and telling them, you need to do the early referrals. Yes. So we introduced a system of blockchain. There's a first time introduced in India on the healthcare system in a tribal area to validate the results. And to validate, like, the referrals are happening through this bhuas and the traditional healers or not. Yeah. And we always see that, sir, because that's the biggest gap and that's the biggest, hindrance in the right referrals and the early referrals, sir. We have worked on that.
You need to take one small section, make it work, bring health to them, bring them into your system, and then use that as an example for the rest. Yeah. I just feel it always works. When they have some kind of a reference, अरे वो गांव में तो सब ठीक हो गए तो चलो इसको follow.
And then they start following it like this.
And then the following happens.
But more luck to him because he's moved to Rajasthan and Gujarat.
Yeah.
So obviously it's that little
exactly.
model
It spreads,
is working.
Word spreads.
So good part is NDTV is basically following the story from when we announced the launch of this program, how the facilities were and how the facilities are. Yeah. What was the number of hospitalizations which were taking place earlier and now, and actually like seeing a lot of rejoice and happiness in the community, like abhi bacche mar nahi rahe hain from 2 years.
And a huge, we've seen that transition. Infrastructure plays a huge role here. Because when the kids, even if they're staying there, when they're being treated for malnutrition, you can see, they've got toys to play, the joy on their faces. We spoke to some mothers and they were like, actually our kids are becoming fine. Earlier they weren't allowed to come. The family said, if the mother goes for 10 days or stays for 14 days, who will take care of the house? But when they see the child's health is improving, the transition was really fantastic. Infrastructure,
Great.
So I will invite you to visit the field whenever, sir, you can.
I would love to do that as soon as, mobility is allowed in this pandemic. It's a huge problem.